Lung cancer is the leading cause of cancer-related deaths. Non-small cell lung cancer, or NSCLC, accounts for 80 to 85% of lung cancers. Normal signaling from epidermal growth factor receptor, or EGFR, promotes cell proliferation and survival. Mutations that can arise in the kinase domain have been identified as critical drivers of some NSCLC tumors, resulting in tumor growth and metastasis. Two mutations account for approximately 85% of all EGFR mutations. These are exon 19 deletions and the exon 21 mutation L858R. These two mutations also make tumors sensitive to treatment with EGFR tyrosine kinase inhibitors, or EGFR TKIs. Even so, patients with NSCLC inevitably experience disease progression within 9 to 13 months when treated with earlier generation EGFR TKIs. TAGRISSO, or osimertinib, is a third-generation irreversible EGFR TKI with a distinct chemical structure. TAGRISSO is designed to inhibit both EGFR sensitizing and EGFR resistance mutations. TAGRISSO irreversibly and selectively inhibits the two most common EGFR sensitizing mutations, exon 19 deletion and L858R. TAGRISSO also inhibits EGFR T790M, a common resistance mutation. At the same time, TAGRISSO has lower activity against wild-type EGFR. TAGRISSO crossed the blood-brain barrier in preclinical models. In a clinical study, TAGRISSO crossed the blood-brain barrier in 8 healthy humans. TAGRISSO osimertinib is indicated for the first-line treatment of patients with metastatic non-small cell lung cancer, NSCLC, whose tumors have epidermal growth factor receptor EGFR, exon 19 deletions, or exon 21 L858R mutations as detected by an FDA-approved test.
Indications. TAGRISSO is indicated as adjuvant therapy after tumor resection in adult patients with non-small cell lung cancer, NSCLC, whose tumors have epidermal growth factor receptor EGFR, exon 19 deletions, or exon 21 L858R mutations, as detected by an FDA-approved test. TAGRISSO is indicated for the first-line treatment of adult patients with metastatic non-small cell lung cancer, NSCLC, whose tumors have epidermal growth factor receptor EGFR, exon 19 deletions, or exon 21 L858R mutations, as detected by an FDA-approved test. TAGRISSO is indicated for the treatment of adult patients with metastatic EGFR T790M mutation-positive NSCLC, as detected by an FDA-approved test, whose disease has progressed on or after EGFR tyrosine kinase inhibitor TKI therapy. Important safety information for TAGRISSO, osimertinib. There are no contraindications for TAGRISSO. Interstitial lung disease, ILD, pneumonitis, occurred in 3.7% of the 1,479 TAGRISSO-treated patients. 0.3% of cases were fatal. Withhold TAGRISSO and promptly investigate for ILD in patients who present with worsening of respiratory symptoms, which may be indicative of ILD. For example, dyspnea, cough, and fever. Permanently discontinue TAGRISSO if ILD is confirmed. Heart rate-corrected QTc interval prolongation occurred in TAGRISSO-treated patients. Of the 1,479 TAGRISSO-treated patients in clinical trials, 0.8% were found to have a QTc greater than 500 milliseconds, and 3.1% of patients had an increase from baseline QTc greater than 60 milliseconds. No QTc-related arrhythmias were reported. Conduct periodic monitoring with ECGs and electrolytes in patients with congenital long QTc syndrome, congestive heart failure, electrolyte abnormalities, or those who are taking medications known to prolong the QTc interval. Permanently discontinue TAGRISSO in patients who develop QTc interval prolongation with signs or symptoms of life-threatening arrhythmia. Cardiomyopathy occurred in 3% of the 1,479 TAGRISSO-treated patients. 0.1% of cardiomyopathy cases were fatal. A decline in left ventricular ejection fraction, LVEF, greater than or equal to 10% from baseline, and to less than 50% LVEF occurred in 3.2% of 1,233 patients who had baseline and at least one follow-up LVEF assessment. In the ADAURA study, 1.5%, 5 out of 325 of TAGRISSO-treated patients experienced LVEF decreases greater than or equal to 10% from baseline and a drop to less than 50%. Conduct cardiac monitoring, including assessment of LVEF at baseline and during treatment in patients with cardiac risk factors. Assess LVEF in patients who develop relevant cardiac signs or symptoms during treatment. For symptomatic congestive heart failure, permanently discontinue TAGRISSO. Keratitis was reported in 0.7% of 1,479 patients treated with TAGRISSO in clinical trials. Promptly refer patients with signs and symptoms suggestive of keratitis, such as eye inflammation, lacrimation, light sensitivity, blurred vision, eye pain, and/or red eye, to an ophthalmologist. Post-marketing cases consistent with Stevens-Johnson syndrome, SJS, and erythema multiforme major, EMM, have been reported in patients receiving TAGRISSO. Withhold TAGRISSO if SJS or EMM is suspected and permanently discontinue if confirmed. Post-marketing cases of cutaneous vasculitis, including leukocytoclastic vasculitis, urticarial vasculitis, and IgA vasculitis, have been reported in patients receiving TAGRISSO. Withhold TAGRISSO if cutaneous vasculitis is suspected. Evaluate for systemic involvement and consider dermatology consultation. If no other etiology can be identified, consider permanent discontinuation of TAGRISSO based on severity. Verify pregnancy status of females of reproductive potential prior to initiating TAGRISSO. Advise pregnant women of the potential risk to a fetus. Advise females of reproductive potential to use effective contraception during treatment with TAGRISSO and for 6 weeks after the final dose. Advise males with female partners of reproductive potential to use effective contraception for 4 months after the final dose. Most common, greater than or equal to 20%. Adverse reactions, including laboratory abnormalities, were leukopenia, lymphopenia, thrombocytopenia, diarrhea, anemia, rash, musculoskeletal pain, nail toxicity, neutropenia, dry skin, stomatitis, fatigue, and cough. Please see complete prescribing information, including patient information, available at TAGRISSOHCP.com.